topic of falls in older adults is something that's near and dear to my heart as a geriatrician. First and foremost, the risk of injury from a fall is a particular concern. Patients are at risk for not just bumps and bruises, but fractures or broken bones. Hip fractures can particularly impact independence. There are more far-reaching implications for patients who fall, such as fear of falling and loss of independence. While falls are common in older adults, falling is not a normal part of aging. So sometimes a fall might be the first symptom of an underlying medical condition, and certainly any person who has a fall, I would urge them to mention that to a medical provider to prompt an evaluation for underlying causes. When we think about risk factors for falls, we like to categorize them into intrinsic and extrinsic causes for falling. Intrinsic, or those that are inherent or related to the patient, include advanced age, problems with vision, medical problems. Extrinsic factors are those that are external to the patient, include largely things like environmental hazards, so throw rugs, lack of adequate grab bars to help someone, for instance in the bathroom, clutter, poor lighting, even medical equipment such as oxygen tubing. All of these can pose hazards. Even if a patient didn't sustain an injury in a fall, it is very important for them to mention this to their medical provider. Sometimes a fall might be the first and only symptom of an underlying medical condition that needs further evaluation and management. Medications absolutely are related to risk of falling. Studies show that taking 5 or more medications puts persons at risk for falling. We have developed the Safe Steps program, which is a multi-specialty, comprehensive program for the evaluation of patients who fall. Patients see 2 medical providers from different specialties. So patients see myself, a geriatrician, where I perform the medical evaluation. In addition, patients see a physiatrist, which is a rehab medicine doctor, who is an expert in neuromuscular conditions, balance, and also therapy, as well as assistive devices. Finally, patients are also seen by a nurse from our Strong Bones program. So we look at their bone health, whether they've had an evaluation for osteoporosis, and whether they need further management in that regard. The most important thing is performing a detailed history and evaluation in order to gain more information about what led to the fall. So when I evaluate a patient, I ask in depth about what were they doing at the time of the fall? Did they have any associated symptoms such as dizziness? Did they take any medication? Have they had any changes in their health status? Those sorts of questions. Most of the patients we see are age 65 and up, the classic geriatric population. However, there are a number of patients who might have more functional limitations even at a younger age, and those patients are certainly appropriate for referral as well.